Okay, good afternoon. It is 12:48 on Wednesday, October 29th, 2025 for me. And this looks really blurry to me. I apologize if it looks blurry to you, but that'll be okay because today, what I'm going to do is I'm going to show you a presentation. Um, And so the presentation will not be blurry. And I am figuring out more and more how to do all this. Um, so what I'd like to talk to you all about is exactly what it is that we're doing here. Yay. And this is Brightside Integrative Physical Therapy, and this is my business. It's just me. Um, and what you see in the image is what I am looking at right now. I have my whiteboard and my things behind me, and then in front of me, I have a table with shelves and stuff that you can see. So now we're all sort of oriented into the same space together. And thank you for being here with me today. So this is a list of my special interests. These are the special interests that I developed throughout the course of my life and my lived experiences that have now sort of swirled together into Brightside Integrative Physical Therapy. And I didn't really know what I meant by integrative when I coined that a few years ago. And I think I know more about that now. And what I would like to talk to you about is that idea of integrative somatics, clinical somatics, as it's been seriesed on my YouTube channel. Um, and it can continue to evolve what we want to call it, because what it also is neurodevelopmentally informed physical therapy. Dr. Christina Jensen, that's me. Let's talk about it. So here I am, and I am educated and credentialed at this stage in my life. And what I've also included here are some quotes that I remember hearing about myself as I was growing up. Maybe some of that resonates with some of you. Maybe some of that sounds familiar. Maybe you have an image in your head of those kids. As a physical therapist, this is what I am called to. So the American Physical Therapy Association, when they sat down to draw out their mission statements and their bylaws and all of that sort of thing, their vision that they vocalized was to transform society by optimizing movement to improve the human experience. And I just love that. And I was like, that sounds so sweet and so lovely. And absolutely, I want to participate in that. Optimizing movement in order to transform society. Curious. Ultimately, what we're here to talk about is how do we improve the human experience? What does that even mean? Because it's all part of this same vision. So let me tell you a little bit more about me. I have special interests. I have um, a history in writing and creative writing and storytelling and poetry, and I'm creative in that way. And I've worked in a lot of different settings, and I've worn a lot of different hats, and I've um, been successful in a lot of different roles. Um, and then I get bored, when I had my child in 2010, I hadn't been I had been a rather indoorsy, sedentary person for quite some time, and I was never really athletic when I was a kid. Although I enjoyed activity, I liked climbing trees and digging in mud and doing those kinds of things. So as I went into my adult body, my postpartum body, and I learned how to get into my body and I learned how to get strong again. Because I needed to be stronger after I had my daughter. Um, and so I got stronger and I learned what it felt like to get stronger. And I was like, ooh, I like this. Um, and so I went to PT school and I decided that that was going to be good for me. And I did a lot of learning and I did a lot of teaching and I did a lot of learning about teaching and teaching about learning, actually. Um, and studying learning theory and how to package information in a way that elicits engagement organically. And then in the very beginning of 2020, I entered my dream job as a pelvic health physical therapist. Because for me, that was where everything was meeting in the middle. Um, some other things about me now through all of this. I see patterns in things, and I'm a quick learner in at least some ways. And I started seeing some patterns once I got into healthcare. Pelvic issues, hypermobility, big problem, especially for pregnancy and postpartum recovery. Unregulated stress patterns right at the beginning of COVID. Definitely saw some unregulated stress patterns, experienced some unregulated stress patterns. My coworkers, my colleagues at the time, all of us in proximity with each other, survival oriented, burnout. These are things that I think most of us can resonate with some version of this experience. Aberrant biomechanics means that there's something about this person that moves a little strangely, moves not really quite like the textbook said they're supposed to be moving. And a lot of them had chronic symptoms, chronic pain, things that had been going on for a really long time with no good explanation from anyone. And a lot of them have kids that were ADHD, autistic, or some other sort of neurodevelopmental spectrum disorder. That often looks like sensory processing disorder and other forms of overwhelm in the kiddos. So let's think about optimizing movement. Aberrant biomechanics, let's optimize that. What are we talking about? We start at the beginning. When we become human initially, we have to navigate the birth canal. We have to slither. When was the last time that you got down on the floor and slithered? We have to slither. We have to crawl. We have to roll. We have to have head control and be able to look around our environment while multitasking in other ways so that we can successfully, adequately, safely explore our environment. There are things that humans need to be able to do from a functional standpoint. And yes, every body is different and modifications always exist. But this is kind of the basic framework that we might look at if I were, for example, say a pediatric provider, which I'm not. Every time that kiddo comes in there, every month of the first year of life, I'm going to be holding up this chart to see how they look. Another thing that we look at in littles is retained primitive reflexes. So primitive reflexes are some of these inherited motor patterns that we are all born with. And so they're unconscious at first, they're just automatic. And then as we develop, as we, right, master some of these other motor patterns, those reflexes integrate, meaning that they soak in and they become conscious. And then we aren't having these sort of uncontrolled movements that are just sort of like jerking and pushing us through life, but we have conscious agency in how we're inhabiting our bodies. Now, then in young kids in the pediatric population, they will screen for those reflexes pretty routinely. I don't have good information about how often and who is screening for retained primitive reflexes in adults. But if you look it up, this is a list of symptoms that you would see for retained primitive reflexes in kids. We also know that people who are on the ADHD spectrum exhibit a lot of these manifestations. Interesting. So there are exercises we can do for these too. Here's my hypothesis. Primitive reflexes and primal movement patterns equip the developing human to orient itself and safely explore its environment. Without these mechanisms, the organism cannot reliably, maybe sometimes, but not reliably establish safety, which drives a perpetually upregulated nervous system, sympathetic nervous system. This is our anxiety. This is that survival orientation. This is that uncertainty that we're going to be okay. Are we going to make it through this? Are we going to live through the night? Upregulated. That's what most people would call stress. I talk about stress a little bit differently, but you get the idea. In the survival-oriented world, time moves strangely. Not that it speeds up or that it slows down, but when we are sort of in that state over time, time dilates according to the subjective experience that we're having. So it's going to move strangely and it's going to fluctuate, and it makes keeping track of time and arriving to events on time and remembering to complete assignments on time difficult. It makes it difficult. Relationships are confusing because I don't know if this person's about to, like, eat me like a tiger. I don't know if I'm safe with this person. I don't know what their intentions are. Can't trust them, perhaps. Or maybe this is the person that I can trust only. This is my primary attachment figure, that without this person close to me, close to my body, I'm fearing for my life. So relationships are confusing when you have those kinds of drives activated. Lights are brighter, sounds are sharper, and everything is just a bit more stressful. And that is like holding a microphone to the speaker, and that feedback pattern begins, and it's traumatic in and of itself. This pattern becomes traumatic. Let's talk about trauma. We need to improve the human experience. I have committed to participate in improving the human experience. And humans, by and large, that looks weird with the blur. We have a lot of trauma. And trauma can be one horrible thing. Trauma can be death by 1,000 cuts. Trauma can be so insidious that we haven't even fully registered that it's happened, but it changes the way that we inhabit our body. And it thereby changes the way that we show up in our life. And what we do know is that there's a lot of overlap when we're talking about trauma presentations. We're talking about neurodivergent presentations. And we know that the neurodivergent experience is, in a lot of ways, inherently traumatic, according to the feedback pattern that we were just talking about. So, what happens? What do we see right there in the center of that diagram? We see burnout. We see overwhelm. We see problems with executive dysfunction, adulting. We see emotional dysregulation, and we see sensory sensitivities. And that's going to include things like autoimmune responses, autoimmune overdrive, inflammation, endocrine problems. It can look different in everyone. Interesting. Neurodevelopmental disorders and trauma are both heritable patterns. And that's all I'm saying about that, is that they're both heritable. And if you didn't know that trauma was heritable, welcome. So society is being transformed as we continue throughout time and space, as history unfolds, as we continue to have babies and have grandbabies. We are transforming society in the way that we hold our experiences and the way that we allow our experiences to change us. What does that mean? Somatic means body, physical body, 3D body. Somatic is the counterpart to psychology, soma and psyche, thanks to Carl Jung. We are having a live experience inside of our bodies all the time. And when we get upregulated or downregulated, it creates chemical changes. Upregulation and downregulation is really interesting in humans as opposed to other species because we have imagination and we can daydream and we can catastrophize and we can absolutely stimulate ourselves into somatic responses, for better or worse. If we don't have executive functioning in that regulatory process, that makes the body feel very chaotic and very unsafe, unpredictable, even unfamiliar. And if you're living in a constant state of sensory processing overwhelm, then that makes so much sense. Doesn't it? Doesn't it make so much sense that the idea of trying to pay too much attention to anything that's going on, below my cheekbones, I just might not have time for it. Public schooling takes a 5-year-old child who is at the peak of their primitive motor development and sits them in a chair and says, look at this desk, look at this screen, take this tiny little thing and write tiny little words. And don't wiggle and don't make noise. And if you have to go to the bathroom, hold it. That's public schooling and has been for a few generations at this point. We teach dissociation from a young age. We teach regulating within an artificial structure rather than regulating in relationship with one's own somatic experience. Interesting. So physical therapy, which is what I do, is offer practical solutions for real functional challenges. We're going to respect the fact that the psychology exists, and we're going to acknowledge that the physical body is a really powerful vehicle for creating meaningful changes in the subjective experience. So let's talk about this bottom up processing, which starts with the central nervous system, which starts with that ability to self-regulate, which starts with integrating these primitive reflexes and these sensory systems in a skillful way to add challenge and complexity in a controlled environment like medicine, dosing it accordingly, but starting to build these somatic skills from the bottom up develops the body itself into a trustworthy mechanism. If I don't trust that I'm safe to stand on one leg and still look around this room, then that's going to impact the amount of information that I can take in from this room. It's going to impact how clearly I can put words together in this moment in order to communicate effectively with you all. So all of these things scaffold on top of each other. Practical safety with dynamic self-regulation meets in the middle in this place of embodied competence. This is the subjective experience that is safely held by the body and competently able to navigate the local environment. The next few slides are some evidence, and I'm going to move efficiently through them, but this is a really important resource by a practitioner named Sonia Story, who has been really paving the way for some of the rhythmic interventions that I use a lot of. And she has done my homework for me and compiled the evidence to support those interventions. And she has her organization that works with kids. What about adults? I work with adults. So there are some studies that indicate that we can create those kinds of neuroplastic changes in adults similarly. That research is very fledgling. Who wants to do research? Speaking mechanically, we also know that neurodivergent individuals are more likely to have joint hypermobility, soft tissue hypermobility, orthostatic symptoms, which is things like POTS, blood pressure fluctuations, if you get dizzy when you stand up too fast, that sort of thing, and also pain, especially in females. Females also have a higher prevalence of autoimmune conditions, incidentally. Interesting. Retained primitive reflexes show up in all of these populations. And it is suggested in the research that when we do those types of interventions in kids, in babies even, that's what pediatric PT and OT look like often, are activities intentionally designed to integrate those primitive reflexes, something as simple as head turns, right? Interesting. This part is tough. This part is tough because remember, we physical therapists, I are trying to improve the human experience. And suicide is 25 times worse for autistic adults than for neurotypical adults, according to this particular study. Autistic adults are 25 times more likely to attempt suicide. This is an emergency. This is a quality of life emergency for everyone who is being impacted by these spectrums. So what can physical therapy do about it? And this is what I do about it. Let's address the physical body. Let's take care of the joints and the soft tissues and the spine and the muscles and the reflexes and the cardiovascular system and the respiratory system and all of those things that need to function. Let's integrate the primitive reflexes, because when we establish the body as a trustworthy mechanism, we're going to be able to self-regulate more skillfully. I just realized I'm looking at a different slide. We're going to be able to self-regulate more skillfully, and we're going to feel better. We're going to feel better in our life. And I'm just fascinated right now because I'm looking at this slide of all the problems, and I'm gonna just give you the solutions right out the gate, apparently. So these are the solutions that I use. Notice that manual therapy is in 3 out of 4. Having hands-on treatment to support and hold space for the changes that we're inviting can be really effective for a lot of different ways, or in a lot of different ways, rather. And we can create creatively empowering embodied experiences. So we're inviting agency to reveal itself, and then we're building exercises around it. So if you want to feel strong, then we're going to put weights in our hands and we're going to hold a strong pose and we're going to breathe and we're going to see what that feels like until our heart starts beating really hard. And we can have fun with that. Lots of different ways that we can play with this work, including the story that we're telling about ourselves and the story that we're telling about what our life has been like and the changes that we're bringing into it intentionally, because we're storytellers. And so is that executive functioning up there, that we have anticipatory programming that's always running in the human brain. That's part of how we're wired, is that we think ahead and we act based on previous experiences. And so if we've experienced something one way, then we start to form an expectation that it will do that again next time. And sometimes creating enough space in our nervous system not to fall into that expectation, particularly if it's really negative, that's hard. That's hard. And we can put exercises around it and get stronger. I don't know that I really need these slides. I think I've already said all of this. Yes, this is shadow work, this is parts work, this is inner child work, this is ancestral healing. But it's not about your ancestors, it's not about anyone other than you inside of your body, and your body remembers your inner child and everything in between. We understand that the physical body is only part of the the coin part of the equation. We have a psychology, we have conscious, and we have unconscious. And the unconscious soma is our autonomic nervous system and our endocrine functions and our immune system and all of that physiology that's always running. That's our unconscious. And we can glean a lot of really great information when we understand how to interpret, how to receive the information that the body's offering in that physiology all the time. It's just here all the time, like a pot of soup simmering on the stove. What's in the soup? So here's your call to action. If you've made it this far with me, I don't even know how long this video is right now. Here's the call to action. We need more research. There's a lot of research out there, way more than I included in this brief presentation, and I'll write a paper about it or something, and we'll get there. But the research supports these ideas in I think in the way that I've offered them. What difference is it going to make in my clients? I don't know yet. I don't have research that I can offer you in the form of clinical trials there. I would love to have that, but I can't do it by myself. So how common are these symptoms that I've observed? How common are those patterns that I observed at the beginning of the presentation? What is the effectiveness of this combination? How do we need to structure these interventions systematically in order to get optimal results, optimize movement? There are lots of exciting questions to ask. And what are the long-term implications of this at the population level? Could this transform society? The truth is that there's a well-recognized lag, right, between research and what we can actually see in the clinic. 17 years is someone's childhood. We're talking about neurodevelopmental disorders. We're talking about trauma. 17 years is someone's childhood. This is an emergency. So in the meantime, let's explore, let's stay curious, let's start looking at these patterns as if maybe they're attached to something bigger than any one gene, any one experience, maybe even any one individual that carries the cumulative genetics of their entire ancestry. It's supposed to be fun. I'm easy to get in touch with. Let's do this. All right, I'm gonna stop this now. I don't know if it was terribly blurry or not, but happy Halloween. See you next time.